If you've been researching testosterone therapy, you've probably noticed something that's a little frustrating. One clinic might recommend testosterone injections. Another might say that creams are the best. And another might recommend Enclomiphene. Someone else might tell you to just simply take hCG. And then you might even start hearing about estrogen blockers such as Anastrozole. Suddenly, you're starting to compare 4 different treatments without really understanding what any of them actually do. The reality is that these therapies are not interchangeable. Each one serves a different purpose. Each one works through a different mechanism, and each one is appropriate for a certain type of patient. The good news is that once you understand each therapy, the entire picture becomes surprisingly simple. In this video, I'll explain the major types of treatments that are available today, who they're designed for, and how clinicians actually decide which patient gets which therapy. Because the difference between good hormone care and bad hormone care isn't necessarily the medication. It's all about choosing the right protocol for the right patient. Let's start with the most common treatment, testosterone itself. Typically, that means testosterone sapinate injections, or for men who prefer a needle-free option, we have topical testosterone cream. When testosterone levels are genuinely low, men often experience a familiar pattern of symptoms: reduced energy, low libido, loss of muscle mass, and increased body fat, slower recovery from exercise, brain fog, and reduced motivation. Overall, it's a general feeling that they're not operating at their best, because they're not. Testosterone therapy works by replacing what the body is no longer producing in adequate amounts. The mechanism is straightforward. You increase the circulating levels of testosterone so that the tissues and systems that depend on it to function properly can function at their best. For many men, that can translate into improved energy, better sexual health, improved body composition, stronger recovery, and an overall improvement in quality of life. Testosterone sapinate injection is typically administered once or twice a week to maintain steady levels. Testosterone cream, on the other hand, is administered daily. For men with clinically documented testosterone deficiency, testosterone replacement is the foundation of treatment, and it's typically what people think of when they hear the term TRT. But there's one important consideration that every single man should understand before starting this therapy. When testosterone is introduced from outside of the body, your body recognizes that testosterone levels are now where they should be, and it reduces its signaling. As a result, the testes receive less stimulation, and natural testosterone production declines. For many men, this is not a major concern, but fertility does deserve a conversation. Testosterone therapy can reduce sperm production over time, and that's why it's critical that fertility goals are discussed prior to beginning any therapy. The good news is that modern hormone optimization offers several ways to address this issue. If preserving fertility is important to you now, or it might be sometime in the future, there are additional therapies that specifically address this and maintain testicular function and sperm production. The 2 most important are Enclomiphene and hCG. Enclomiphene has become increasingly popular because it addresses testosterone deficiency from a completely different angle. Instead of replacing testosterone, Enclomiphene will tell your body to produce more of it. Think of it as improving the communication between your brain and your balls. Normally, the brain sends signals to the testes and it tells them how much testosterone to make. Enclomiphene enhances that signaling process, encouraging the body to produce more natural testosterone. The result is higher testosterone levels while keeping the testes active. This is often why Enclomiphene is an attractive option for younger men and for men who want to preserve their fertility. In clinical studies, Enclomiphene raised testosterone levels while maintaining sperm production, whereas traditional testosterone therapy also increased testosterone, but it suppressed many of the hormonal signals needed for fertility. For men with secondary hypogonadism, where the issue is with the brain, not the testes themselves, Enclomiphene is an excellent first-line option. It's taken simply as an oral tablet, typically once a day. For the right patient, it can provide many of the benefits of normal testosterone while maintaining the body's normal production pathway. For the right patient, it can provide many of the benefits of higher testosterone while preserving the body's natural production pathway. The next therapy is hCG, which stands for human chorionic gonadotropin. hCG works differently than both testosterone and enclomiphene. Its role is to mimic one of the hormones in the body that tell the testes to stay active. In practical terms, hCG helps maintain testicular function. Clinicians commonly use hCG in two situations. The first is alongside testosterone therapy. When a man starts testosterone, hCG can be added to help maintain testicular function and support fertility goals. Many men appreciate this approach because it allows them to receive all the benefits of testosterone therapy while maintaining normal testicular function. The second use is as a standalone treatment for certain men whose primary issue is inadequate hormonal signaling from the brain. In those cases, hCG can be used to replace the signal that's missing. The final therapy is anastrozole. Unlike the other therapies that we've discussed, anastrozole is not used to increase testosterone. Its purpose is to help manage estrogen levels when necessary. Now, this is where a lot of misinformation exists. Many men hear the word estrogen and automatically assume that lower is better. That's not true because men need estrogen. Healthy estrogen levels support mood, libido, bone health, and overall well-being. Our goal is not to eliminate estrogen. It's simply to balance it. As testosterone levels rise, some of that testosterone gets converted into estradiol, which is a form of estrogen. For most men, that's completely normal, and absolutely no intervention is required. However, some men will convert more testosterone into estrogen than others. When estrogen levels rise disproportionately, certain symptoms can occur. Symptoms such as water retention, breast tenderness, mood changes, and reduced libido. When labs and symptoms indicate that estrogen has become excessive, anastrozole may be used to get those estrogen levels back into the appropriate range. The key word here is appropriate, not zero. Having too little estrogen can create its own problems. And that's why experienced clinicians use anastrozole selectively, not automatically. Because good hormone care is all about the balance, not the extremes. So, how exactly does a clinician decide which therapy is right for which patients? In practice, the decision usually boils down to three questions. First, what do the labs show? Second, what symptoms is the patient experiencing? Third, what are the patient's fertility goals? Those answers reveal a tremendous amount. Some men are ideal candidates for testosterone replacement, and others are ideal candidates for enclomiphene. Others may benefit from hCG, whether it's alone or alongside testosterone therapy. The bottom line is that the treatment should fit the patients, not the other way around. That's why comprehensive lab work matters, and it's also why ongoing monitoring matters. Hormone optimization is not simply about handing somebody a prescription and hoping for the best. It's a structured, long-term process that evolves based on blood work, symptoms, and long-term goals. The world of men's hormone optimization becomes so much more simple once you understand the purpose of each therapy. Testosterone replaces. Enclomiphene stimulates natural production. hCG supports testicular function. And anastrozole helps manage estrogen when needed. Each has a role and each has a place. And the right choice depends on your biology, your symptoms, and your goals. Our goal is not to put every single man on testosterone. Our goal is to identify the cause of low testosterone symptoms and pick the therapy that's right for the individual. That process starts with comprehensive lab work and a clinician evaluation. If you'd like to know where your hormone levels stand and what options may be appropriate for you, start with our initial TRT panel because the best protocol is the one that's built specifically for you.